ẹ̀fọn tó gbòòrò àtúnlọ́wọ́ àwọn tó rẹ̀rọ. Kẹ́kúlẹ̀ gbà kó sàfún tókò. Cleanliness is essential. Immortalize your potential. On the sound of crimes and your initial.
Mọ́tótó borí àrùn mọ́lẹ̀, àṣẹ ní ká àṣẹ lọ́jọ́. Àyíká.
Good day, viewers. You're welcome to another episode of your favorite program, Health Talk. It is a pleasure to have you join us on the program. On Health Talk, we address various health issues affecting our society. I remain your favorite host, Helen Akonji. Don't forget to join us on our social media platforms. You can follow us on Facebook, Twitter, and Instagram at Health Talk to be part of the program. Today, we'll be talking about female genital mutilation, also known as female circumcision. As we all know, female genital mutilation is a very rampant issue in the country, most especially in rural areas, among people living in rural areas. So we have with us today a doctor who will shed more light on female genital mutilation. But before we introduce our guest, let us go on a short break. We'll be right back. Don't go anywhere.
What mama told me, brown skin girl, your skin just like pearls. Your back against the world. I never trade you for anybody else. A brown skin girl, your skin just like pearls. The best thing in all the world. I never trade you for anybody else.
Pose like a trophy when Naomi's walking. She need an Oscar for.
Welcome back, viewers. If you're just joining us, we are still on Health Talk, and we'll be talking about female genital mutilation and its effects. Here with me is a doctor from Osun State University Clinic, and he'll be enlightening us on female genital mutilation. Good afternoon, sir.
Hey, good afternoon.
Thank you for joining us on the program.
Yeah, welcome.
Please introduce yourself to our viewers.
Thank you. My name is Dr. Ibrahim M.A. I'm a specialist family physician. I'm the coordinating medical officer for Ikiri Health Center, Osun State University.
To start with, sir, what is female genital mutilation?
Yeah, thank you. Female genital mutilation, also known as female genital cutting, or some people may also call it female circumcision. Yes, it is formerly we regarded it as circumcision, female genital circumcision, but because of the way the new trend, the way people now look at it as something that is not welcome, and that's the reason why the term female genital mutilation, anything that is involved, any procedure that involves partial or total removal of female external genitalia or any other injury to the female external organ that is not for any medical reason is termed as female genital
sir, at what
mutilation.
age is female genital mutilation performed?
Yeah, you see, as you can see, female genital mutilation can be performed at any time. Because this mutilation, this culture is a cultural thing. The phenomenon is a cultural thing. And if you look at male circumcision is done in infancy, at least during the first year of life or before the 5th year, or mostly, but can also be done at any other time. So because the tradition believes that female also need to be circumcised, and they attract a lot of social, cultural, and even spiritual to it, So some can do it in the infancy during the first year of life. Some can delay it and use it to mark a festival. Some have an idea of looking at it as a way of transition from childhood to adulthood. So if you look at all those perspectives, it can be done during the first year of life. It can be done for adolescents while transforming to a womanhood, because it is a way that some culture perceive it as a lady being marriageable. If you have not been circumcised, then you cannot be married out. So it can be postponed to when they are doing a festival for a community to show that these particular girls that were age mates are now moving from being children to adults. By the time they are preparing for their marriage. Also, it can be done in some culture after delivery or before delivery. So it can be done at any point in time for a female.
Alright viewers, let's go on a short break. When we come back, we will continue from where we stopped. Don't go anywhere, we'll be right back.
Goodness and mercy follow me every day. Everything when I touch for this life, anything when I want. She not my no, she not Porsche, oh. Now me get on. If they're the dirty, no mind them. If bottom belly come me, you buy them. My time don't come me, oh.
Welcome back. We are still on the program Health Talk. Before we went on that short break, our guest gave a brief insight on female genital mutilation. Let us continue from where we stopped. Sir, why is female genital mutilation performed?
Yeah, there is a lot of reasons why female genital mutilation is performed. It's majorly due to cultural and social circumstances. You can see those that engage in female circumcision are majorly women. The circumscribers, they are majorly women. They are mothers. They are traditional people, and these are the people that maintain culture, values, and social norms. So the reason why female genital mutilation is performed is based on this, because one, they believe, there's a lot of beliefs about the female genital mutilation. It is believed that the clitoris of the female during childbirth, when it comes in contact with the female head, can lead to the death of the baby or the mother. Yeah, they still look at it that the female genital organ is not beautiful without cutting some part of it. So for it to be beautiful, they believe they should cut, for aesthetic reason, they believe they should cut part of it. Although they also believe that women who are not circumcised can be promiscuous. So to prevent promiscuity, they tend to do female genital mutilation. And also, it is believed that if you are not circumcised, your marriage value will be reduced, because of the norms in the society. Men we usually want to marry, where it is being practiced, men we want to marry somebody that is circumcised. So if a girl is grown up to be married out and is not circumcised, she may not have a potential husband. Once they are aware that she's not circumcised, men may be running away that they are not willing to marry. So these are some of the reasons why female circumcision.
So sir, what are the disadvantages of female genital mutilation?
Yeah, disadvantages. I can see disadvantages, or let me say complications. What are the things that can occur following female genital mutilation? You see, during the procedure, it's about cutting some part or the total of the female external genitalia, and can also involve suturing some parts together to close the vagina. So when this is done, during this process, we can have complications. The complications can be immediate or late. The immediate thing, during the cutting, the patient can continue to bleed. And if care is not taken, it can lead to death when you lose large amount of blood. Now, usually they use unsterilized materials for this cutting. Dirty materials, not properly cleaned and sterilized. So you can introduce infection. They can use one for several children or several males. Blood-borne infections, HIV, hepatitis can be introduced. Then during the cutting, the female urethra opening, where women used to urinate, is also closed there. They can cut it so deeply that it can affect that. The cutting may go along to cause what we call fistula, vesical vaginal fistula. Urine can start to leak into the vagina, or rectal vaginal fistula. Feces can start to be coming out from the vagina. So then, after this procedure, especially when there is infibulation, that is the third stage of female genital mutilation. When a procedure is done to almost close the vagina opening, this woman cannot have sexual intercourse at all. And it is purposely done so that they can incise this place when they want the woman to be having sexual intercourse. This in a way prevents the woman from having sexual intercourse. Then after removing all these parts, the woman may not even have sexual satisfaction or enjoyment in life. During childbirth, the place is cut.
So we are still coming to that, sir.
Okay.
Maybe we should move to the next question. So how does female genital mutilation affect the health of women and girls?
Yes, it affects them a lot, because sex is to be enjoyed, especially in marital life. So at the end of the day, when a woman is married, after being circumcised, she doesn't have interest, or she cannot enjoy sex. There's going to be a lot of problems, because studies have been done that shows that women who are circumcised, they don't enjoy sex at all, or they have painful sex, which we call dyspareunia. They have pain while having sex, which even reduce their request for sex, and they may not even enjoy sex at all. Some other problems that can have is that I've mentioned some of them. During childbirth, because this place, depending on the degree of this cutting, after cutting, this cut will heal. They suture it, it will heal, but it will heal with scar, not a normal tissue. And during that childbirth, that place left, it is so small for the baby to pass. And when baby is forced to pass this place, there can be damage to that part and can cause bleeding. The patient, the baby, having a lot of struggle to come out, may even die following the birth. Then the woman can sustain a lot of injury, which can affect his bladder, where he is urinating, also the rectum, and a lot of complications. And that might even alone lead to the death of the woman. So there is a lot of problems that is attached to this procedure.
Alright viewers, so we'll go on a short break. When we're back, the program continues. Please stay tuned.
Spanker.
the remix, yeah.
Welcome back. We are still on Health Talk. We will continue from where we stopped. So what are the consequences of female genital mutilation during childbirth?
Yeah, it's part of the late complications of female genital mutilation. You know, during childbirth, I've said that depending on the degree of the cutting, female genital mutilation has levels, stage 1, stage 2, stage 3, which are the first stage, just cutting near the clitoris or part or the total. The stage 2, cutting of the labia minora. Stage 3, cutting all the labia majora and minora, then suturing it back, what we term infibulation. This will cause a lot of scar tissue there, and we only leave just a small hole that can hardly permit sexual intercourse, which need to be cut open later in life to allow sex. So this scar tissue that has formed has prevented the normal passage of the vaginal opening. So during childbirth, it may be difficult for the baby to come out as normal. So during this time, the baby may stay longer than necessary, and the baby may die shortly after. If this baby should also pass through, there can be tear, and when this tear occurs, it won't occur the normal way. It causes something ragged tearing because it is scar tissue, it's not normal tissue, so it's torn in different directions, and this can go to the bladder, go to the rectum. So after the delivery, the woman can be leaking urine in the vagina, or the feces can be coming through the vagina, and it's very difficult to manage.